get started, this panel is called Ketamine-Assisted Psychedelic-Assisted Therapy, accessible now, Ketamine-Assisted Psychotherapy. So from here on out, I will refer to Ketamine-Assisted Therapy as CAP. Today we're going to be exploring both the clinical and lived experience of ketamine-assisted psychotherapy, how it works, why it matters, and where this field is headed. I'm Marissa, and I am joined by an amazing panel of practitioners and clients with lived experience who will share their story. So today we have Dr. Haley Fox. She is an integrally informed psychotherapist, writer, and affiliate faculty at Antioch University. She's a licensed to practice mental health counseling in 3 states, holds an LPC supervisor designation in 2 of them, and is board certified in art therapy, music therapy, psychedelic-assisted therapy, and telemental health. Her theoretical orientation is grounded in archetypal psychology, including the role images play in human experience. Dr. Fox lives in the Ozarks, where she operates a school of practice.
Yeah, we're working on it.
And Chiwoo Choi is a licensed professional counselor and founder of Becoming True Self. He specializes in helping clients break free from depression, trauma, and codependency. He is a ketamine-assisted psychotherapy clinician with Thrive and Be Well, offering support to clients in Missouri and Kansas. He sees CAP as a powerful tool for guiding people back to self-love and authenticity. Amanda DiMartini is a licensed professional counselor and founder of Thrive and Be Well, offering wellness-focused psychotherapy to Springfield clients for 17 years. She has co-developed ketamine-assisted psychotherapy programs with Dr. Chiwoo Choi that have been in practice for 3.5 years. Amanda has recently created practice tools to offer other trained psychotherapists in order to expand to group practice and further increase access to this therapeutic modality. And finally, Tamla lived her adult life in Arizona. She received outstanding journalism graduate while earning her bachelor's degree with honors. And then while working on her master's degree in educational leadership as a single parent, she created and formed the advising unit of the Northern Arizona University Honors College. Today, she will contribute to our understanding about the client experience and changes possible with ketamine-assisted psychotherapy. After having a lifetime of trauma response symptoms due to growing up in a toxic familial environment, Tamla felt stuck in trauma response until starting this treatment 6 months ago. Her physical, mental, and spiritual changes in that short time are phenomenal. Tamla says it's been life-changing. So excited to hear about all of their experiences as clinicians and as clients. I'm going to start down the row, start with Dr. Fox. What inspired you to study psychedelic-assisted therapy?
Oh, okay. Thanks. I'm kind of a late bloomer psychonaut. I didn't even, can you hear me okay? I'll go a little closer. Okay, I never even smoked weed until I was 42, and then it was just one try and I didn't like it. But about 2000, I encountered someone in my doctoral studies who has become a best friend of mine who was very deeply into working in the underground with psychedelic medicines. So I was really introduced by her, and since then have found, I guess I was also led in part by my experience as an artist. I'm really familiar with working in the imaginal realm, and as I started experimenting with different medicines, I saw that it was kind of the same thing. Images were coming to me just in a different way. So that's what I'm doing.
Well, thank you so much. And that really helps set the stage. Chiwoo, what about you? What drew you into this work?
Yeah, working as a therapist, a lot of clients struggle with what they think they should do versus what their body, nervous system, trauma, all the history get in the way. And I see psychedelic therapy as a way to access the part of them. You can call that part higher self or their core self. And it provides that opportunity that extends the effectiveness of talk therapy beyond helping them accessing. And so it becomes their reference point to access when they can then integrate and make steady but stable, slow changes to their core self. So that really intrigued me as a therapist, how I can utilize all the options out there for clients who are hurting by trauma, depression. So I find it very rewarding and changed my life, and it's changing other people's lives. So that's why.
It's powerful work. And what do you do?
Hi, thank you. Originally, I went abroad as a young undergrad student to the Netherlands, and I got to experience a culture that had already integrated cannabis into their society pretty responsibly, and psilocybin. And it was a really rigorous program at Leiden University. It just opened my eyes to a whole different way of being. And so when I got back from there, I studied a lot of Stanislav Grof's work on LSD research, and it just changed the way I thought about everything. He proposed that we could transcend psychopathology, and that these tools, would lend itself towards like self-evolution. So I came here to Springfield actually to study advanced degrees in psychology at Forest Institute. And it was my inspiration. And even then it was like taboo. If I brought it up, it was not received well. And so it was interesting. No one really respected it, but I always kind of wanted to do the work. So so today when there was the option of exploring ketamine and its benefits and accelerating personal growth, and for people to transcend their psychopathology, as we call it today. We're very diagnosis heavy, and I like to be wellness focused, and I'm seeing people are getting well pretty quickly, and to see people be not depressed pretty instantly and have motivation to change, it's just fantastic. I'm grateful for the tool to be able to work with. So I'm also keeping up with European research, and they're very, rigorous. So I see that this is likely, going to be the first line of mental health options going forward. It's just not yet, but I do believe it's a thing. So I'm grateful to be able to do this work.
Thank you, Amanda. And Tamala, as someone who's been through this process, you have a really important perspective. What perspective are you interested in seeking ketamine-assisted psychotherapy?
I was seeing the real holistic doctor, Dr.
Chiwoo
Soren, thank you. I was seeing the real holistic doctor, Dr. Chiwoo Soren, and I have a number of physical disabilities that, those invisible ones you don't see. At any rate, got some more bad news beginning of this year, and Dr. Sheely looked at me and went, she needs more than physical help, and referred me to Amanda and the CAP program back in the end of January. And so I have been participating in it since that time. I knew nothing about this form of therapy prior to that.
Thank you, everyone, for sharing what brought you into this. So let's get into a little bit more about what this therapy is and how it works. Dr. Haley, can you tell us what exactly is psychedelic-assisted therapy?
It's, I guess, most simply put, it's applying psychedelic medicines to psychotherapy. Psycholytic therapy was mentioned earlier. That's kind of low doses that you take while you're in a therapy session. Psychedelic therapy is more taking a pretty heroic dose of medicine, preparing for that, taking the medicine, and then following up with integration is the way it's looked at these days.
Yeah, that's a good perspective. And Chiwoo, can you build on that a little bit? Can you describe to us how the practice of ketamine-assisted psychotherapy can help people become their truest, most authentic selves?
Yeah, I was thinking about this question. And so, a lot of people seek this type of therapy into their healing journey. When a lot of things didn't work out for them, this could be one of their last resorts. And so with that understanding, there comes a lot of, expectations. And a lot of times, psychedelic-assisted therapy achieves that goal. But I think what's more important during this process is that they learn how to become their true self. So that might be your goal starting this. I think about it like going to a gym, getting signed up and getting a personal trainer, and you're working through it and you see the result. Maybe you came in to get more muscles or get more fit, But during the process, you get to that goal, but you also learn how to get to that goal if you wanted to. So you get to learn to manage yourself. So let's say a personal trainer walks you through the proper posture, form, intensity, plan for you. And during the process, you learn how to take care of yourself, how to love yourself as you deserve to be. So I help with clients think a lot about their innate ability to heal. We call it in therapy world the inner healing intelligence.
Oh.
So whatever that drew them to choose to get here, helping them to access that part outside of this therapy in their day-to-day lives. That's what, yeah. And if I answer your question,
Yeah, absolutely. That's a great perspective.
Yeah.
And Amanda, if you could just build on that, how does ketamine-assisted psychotherapy help people in a state of better well-being?
Well, first, a little bit describe how it's done. So first, we examine all areas of wellness. So we go through, their lifestyle, what's going on, their history, and then the doctor gets to medically screen them for the suitability of the program. So then a Thrive and Be Well practitioner will support someone for about a month is what we like to do, a month's worth of support. And we have wanting to teach them best practices. So we prepare them very well. We guide them through the experiences. And then there's integration. And all of those steps are very important. And honestly, integration ends up being like an ongoing, there's layers of it. And I'm just amazed, there's just subtle memory recall that happens even in between sessions. So the mind is always kind of working things out too, which is pretty fantastic. So as far as well-being, it seems like a lot of the people who are drawn to us, actually it ties in with one of our talks earlier, childhood stress, childhood trauma. We are just now scratching the surface of the impact, the lifelong impact that has on people. But many of the clients coming in have had decades of distress and they've been labeled this or that. But a lot of it ties back to childhood traumatic events that we believe sets the nervous system on kind of high alert. And so with the ketamine, whether we're doing psycholytic, where it's just a relaxing, soothing experience, or a psychedelic level of experience, we're noticing people feel rested and restored and safe in their body. And many have recognized they haven't felt that. They can't remember the last time they felt that. So I feel like that relaxing component, there's a restoration where there's a little bit of resilience. There's a rebound that happens. And then once people are feeling better, that's when they're able to take on all those areas of life to adjust their behaviors to support their ongoing well-being. So that's how I think it's the rapid antidepressant effects with the nervous system reset gets people on track.
And
She's gonna
we've
ask.
gotten to kind of hear, there's obviously a lot of differences in the structure of psychedelic-assisted psychotherapy. There's the intention setting, there's the experience with the medicine or with the substance, and then there's the integrative session. So just by structure, it's a little bit different, sets itself apart from other psychotherapy. But Tamala, I'd really love to hear from you, from your own personal experience, internally, how has ketamine-assisted psychotherapy been different from other versions of psychotherapy that you have experienced?
Sometimes I think I'm a pro at therapy. I've spent decades doing talk therapy, inpatient therapy, you name it, therapies. I have tried those therapies. Specifically talk therapy, spent, what did I tell you?
5.5-ish?
6 years talking in circles. Never got anywhere. I was the patient that couldn't heal. I gave up. And so when I was introduced by Dr. Soren to Amanda, it was like, okay, what the heck? What have I got to lose? I've tried everything else. We'll try this. Now, my husband is former law enforcement, so I need you to know that he heard ketamine and went, street drug, like I did. And to know that it comes from an actual practice, that it's not a street drug they're prescribing. It's a dosage for the person. They are prescribing it specifically for you. It is the only thing that has worked for me. Dr. Fox, thank you. Dr. Fox mentioned the central nervous system. That is exactly the first thing I noticed about ketamine. When you live in a trauma response body, your nervous system is on high alert at all times. I could not sit up here comfortably today without ketamine. It's that simple. Nervous, crazy, always going, couldn't stop talking. In 8 months, I have been transformed. Was that a good answer?
I love it.
It's a wonderful answer. Yeah. Thank you for that perspective. It's really insightful to see, and the nervous system, drives all of our behaviors. It's the core of us. So something that can be very relaxing for people to allow them to get into themselves. That's a very powerful tool.
Can I say one more thing? Yeah. The other thing ketamine does is it brings one present, like I had never known before. You're not living outside of your body anymore. You are integrated into your entire being. When you calm that central nervous system down, you can start accepting parts of you. You can look at that past pain and go, oh, it's just a memory. It's not going to kill me.
Mm-hmm. Right.
Thank you for that addition. And we are talking a lot today about ketamine-assisted psychotherapy because that is what is legal and accessible now through psychotherapy and through certain degrees that enable people legal access to do that. But also there are other medicines available, and I'd love to hear you all's perspective of how you see that moving forward in the future. And Dr. Fox, what psychedelic-assisted therapies do you have your eye on in the future of care for patients in the military community?
Yeah, I'm particularly optimistic about ibogaine. We haven't started clinical trials in Missouri yet. I think that's coming. I think $40–50 million were awarded in Texas to start ibogaine clinical trials. Incredible promise, especially for opioid addictions, and we know that that's pretty problematic in our state, in our community. So I'm encouraged to see that moving forward. I see more and more of an appetite that's favorable towards psilocybin, which is another really promising medicine for lots of different mental health needs. I'm still hopeful that MDMA will come through and get FDA approval at some point. It's been really powerful for PTSD and for couples who are, all of the medicines have particular efficacy with particular areas. And so my hope, just to reiterate this morning's talk, is that decriminalization will be at the forefront and that there'll be opportunities not only in a medical model, but also in more indigenous, ceremonial, religious sort of practices that people will be able to benefit from those medicines.
Absolutely. And Chiwoo, I know that you have training as a MAPS and MDMA-assisted psychotherapist, or gone through their training program. How has that shaped you as a clinician and the way that you see this work evolving in the future?
Yeah, thank you for that question. So MAPS has been Rick Dublin, been around for over 20–30 years, been doing this research. So they allowed us therapists to get trained. Once the FDA approves this therapy, then there will be lots of demand. So they're preparing professionals to be there. So as one of the pioneers in this path, they are laying down, what it should look like and trying to respect, kind of, you were describing, Dr. Fox, about the community centeredness, how their cultural expectations. So MAPS has put lots and lots and lots thoughts and ethics that we should abide as a therapist. So they talk a lot about touch in therapy settings, it can be such a hot controversial topic, but also really crucial when a client who has an attachment trauma needs the immediate support. So they lay down how to talk about it with the client. And, I found we get to make our own informed consent about it. So for me, I settled on having some cold ice pack in the refrigerator and the freezer and some microwavable heat stuffed animals available. So if they need like some sensational support, then we can provide that without having the physical contact being centered. So, that training really provided me, there are so many different ways. They do 3 preparation sessions before guided medicine sessions, because the set you're bringing and the setting, the therapist being the container, is so crucial. They do 3 sessions, and then after one guided sessions, they do 3 integration sessions. So they put a lot of thinking in how the client go through this amazing healing opportunity, but also how to go through it in a safest container they can create. So that has informed me in a lot of ways, and Amanda, to make it as client-centered and as customizable for your needs. And so.
That's a fantastic answer, because it does bring into discussion a really important piece about healing is therapeutic touch, and knowing that there are other ways to access that with the stuffed animals and the heat packs and cool packs. Just having a somatic experience is so important for the full integration of it. Thank you for that answer. And then Amanda, I know you primarily focus on ketamine-assisted psychotherapy. So what is valuable about working with ketamine specifically?
Okay, yeah, absolutely. One of the things I've been loving is the peaceful nature of it. I was actually revisiting some LSD research, and I was reminded how harsh and like an arduous journey that 12 to 16 hours was. And so it kind of like made me even more appreciate how the shorter duration of 90 minutes and being more relaxing is super important for people, and inherently a boost for people rather than kind of a raw experience you have to recover from. Ketamine seems to be a recovery experience. I also notice it's kind of a therapist's dream, because I've been working with people for about 2 decades, and I've seen people be stuck for years or decades. And then with this medicine, I mean, by session 1, typically, people have increased hope, and hope sometimes was long estranged from them. So once they have hope, there's like motivation and there's change. It's very dynamic. So I get to witness kind of a rapid self-evolution, which is an honor and a privilege to support. But then we get to just help through behavioral things, and people are unstuck. And then I've seen people go on many psychotropic medicines, and I've seen them go off of many psychotropic medicines, but I've never seen anything quite like this as far as just feeling better. And like Tamla said, if you're able to be present, things are changing. Absolutely. Even quality of relationships start to change. So I've never seen that with other medicines. And people are now demanding alternatives from traditional. We've had the antidepressants for, I think, 30 years being the front line, and now they're adding antipsychotics as a normal thing. So people are demanding it, and we're able to deliver something that people typically feel a lot better after a month. And I can't say that about anything else I've worked with. And then additionally, we're finding that we're able to do in-person, but also the remote access. People are really responding well because they're able to do it in the comfort of their own homes, which lends to more relaxation. And they're able to set up rituals of kind of meditation and self-reflection that have ongoing benefits in their lives. So.
Great answer. And Tamara, is there anything that surprised you about working with ketamine-assisted psychotherapy?
Everything. Like Amanda says, the first session that we did, I remember the first feeling I had was weightlessness. And for anybody, I think, living with trauma, there's a heaviness inside you at all times. And just that, there was that, oh my gosh. And there's a fear because you don't know weightless. And then you come back down and it is very gentle and calming. But you had also mentioned hope. I didn't know I had given up on hope until I started the ketamine. And I got my hope back and went, oh my, I'm present and hopeful. Life might actually be good.
Yeah,
So
absolutely.
That's a great perspective, and it also is bringing up the accessibility of ketamine because it is generally a little more accessible to people with different pharmaceutical needs and just emotionally, psychologically. It's prescribed for people with treatment-resistant depression. Because when you get to that far point on the spectrum, it is a very accessible option that is accessible through therapists. So it's really nice to talk about that. But on the topic of accessibility, what concerns, Dr. Haley, do you have about accessibility to psychedelic-assisted therapies?
A couple, really. One is psychedelic-assisted therapies generally take several hours at the very least. And right now, the way insurance reimbursement is set up, you can't bill for extended hours. And so that means it's going to be pretty expensive for people who want to engage in psychedelic-assisted therapies. And even for pretty well-off people, you're looking at thousands of dollars. So there's a social justice issue in that, I think, where people need medical help, or if they need some healing, they ought to be able to get it without going into bankruptcy or something like that. So I'm really worried about that accessibility. I'm a little encouraged. I've seen a couple of models that give me some encouragement. One is, I have a friend, Jeff Batchy, out of Chicago. He started the Sana Collective, S-A-N-A. And they've really been, he and his counterparts there, aggressive in securing philanthropic support and grants and so forth. So they will offer, at no cost, to people who have financial hardships, this psychedelic-assisted therapy is ketamine now, because until other things are approved. So I'm encouraged when I see that sort of thing. And then I also know that in Texas, there's some services provided to veterans, and I'm sorry, I can't remember the name of the gentleman who started this service. He himself was a vet who was helped very much by psilocybin, decided to start serving his comrades in arms, and the way he set up his organization, he had a little money to start with, that helped, but he said, I'll give you the services for free, and if you're helped by it, please, contribute back. And people have been extremely generous. They get their lives together, so they start making money, and they start being successful, and they give back to the people who helped them so much. So I have some optimism, but certainly worries about that financial piece.
Yeah, that's a really big part of the discussion right now is how to make these therapies accessible to more people. There are a lot of people who grow up in disadvantaged socioeconomic positions, and those are often people who experience more trauma. And it's a very important part of that discussion to be talking about how do we make this more accessible for larger numbers of people, not just people from privileged backgrounds. Chiwoo, a little bit of a different direction with this question. You are offering in-office ketamine-assisted psychotherapy sessions to your clients. So what is your approach to guiding clients?
Good question. So yeah, we talk a lot about set and setting in psychedelic-assisted therapy. So it's such a different approach as a therapist, who's been trained with the traditional CBT and, those types of therapies I'm talking to my client about drugs, how it's going to feel, what they should do, and I'm going to be with them as they're doing it. So what a what a jump and what an exciting opportunity as well. The fact that we could access that part. So in person, like I said, mentioned earlier, I do provide like physical support. We provide eye shade and blanket and nice couch that so they can lay down or they can bring their journal, and we set music that evokes emotions and make the environment more comfortable. So yeah, I draw a lot from the MDMA assist therapy, the guide tools, and yeah. And answer your question?
Yeah, absolutely. And Amanda, kind of a similar question for you, because at Thrive and Be Well, you have ketamine-assisted psychotherapy available. Are there any parts of that program that you would like to highlight?
Okay, yeah, I think I'm particularly proud because we have like a couple different programs supporting people's lifestyles. So, you know, some people may want the deeper sessions, and we can support that, the psychedelic sessions. Some people are actually more suited for psycholytic, where they can, you know, rest their nervous systems more often. So we're able to kind of customize and be patient-centered for each of our approaches. So I love that. Additionally, the psycholytic approach kind of works for chronic pain people as well. And so we're seeing really an ability to coexist with the discomfort better, more gracefully. And there seems to be something about the inner healing intelligence, like being a little more tapped in, where many people are stretching and moving and learning to move through some of the discomfort. So I'm really excited about that. And we're also starting to collect data on quality of life measures. So I want to keep that and hopefully partner up with someone in the future about how we can get some research going. And a Harvard professor / researcher did reach out to us and maybe wants to partner. So we might get some neuroimaging backup for some of our quality of life stuff. So I'm excited because you know, we don't know the potential yet, but I can't wait till we find out like hard evidence about the brain growth and the, you know, brain reparations and all of this. So I'm excited for the future of being able to bring data soon.
Yeah, really excited for the data to continue to grow and research in all of these various modalities continue to grow and become more accessible. And Tamara, what types of changes have you experienced through the course of this treatment?
I need my notes. I promise I won't read it all. Amanda asked me to highlight, is this where I am?
Yeah.
Okay. Physical changes. Ketamine for me began with, like I said, calming my very overreactive nervous system. Once my mind could accept that my memories or my past would no longer harm me, my body started relaxing. And Amanda just mentioned the stretching. Once you shut off that central nervous system, it's like the body wants to get rid of that trauma. That's the only thing I can describe, because I just started needing to stretch. My husband's like, what is she doing on the porch out there? I was stretching out my trauma. I swear to goodness, that's the only way I can describe it. So physical, I've only lost 2 sizes. My husband's trying to keep up with me, because as I lose the trauma from my body is responding. Mental, I'm clear. I am present.
Yeah.
Okay, I'm sorry. She wants me to not tell you some of my stuff.
No, go ahead.
Not overshare, but
It's the therapist and me trying to guard it.
The trauma survivor in me wants to tell you everything. I have an inoperable brain tumor in what the neurologists call the worst real estate possible. That I am alive today is a miracle. That ketamine has transformed me in 8 months to be clear again, to feel like I have my brain back again, is indescribable. relational. My husband's out there somewhere. Hopefully he'll back me up. I think we're doing better. I am not afraid to speak with him. And for trauma survivors with attachment disorders, speaking, even asking, is there milk in the refrigerator, can be fraught with food. So I've learned to relax, and learning to relax, I'm able to open up with him more, and he's able to see me better. And part of that too was realizing I had an entire friend group that just needed to go. They weren't growing, they weren't advancing, they weren't moving. And so you find you have to shed the past, literally. Motivational, well, I'm here today speaking with you, so we'll just say that. Creativity, it started with Amanda encouraging me to go back to my creative side, and I pulled out colored pencils and drew a teacup. I haven't drawn in ages, 20, 30 years. And we did say earlier, I am a journalism major. I have not written in 20 or 30 years. And I am beginning the process of writing a book about my life. Functioning, let's see, with a brain tumor, I was known for falling. I was known for a lot of things. Let's guard Tamela. They don't have to guard me today. I'm fully balanced. I'm fully stable. I can walk up and down the steps without the handrail, and you have no idea how important that is. And help with life transitions. Amanda has very gently and carefully walked me through. In the midst of all of this, I literally was attacked by a narcissist. I was raised by a narcissist. So to have that attack in the midst of my beginning of my healing journey was phenomenal in a way, because I got to watch the whole darn narcissistic play be played out, and my role in it, going, I'm the one causing the overreaction. Stop! And I finally did.
I'm sorry. And adjusting to retirement.
Oh, and adjusting to retirement.
That's a big one.
There is one thing I wanted to say. I know we talk a lot about the investment, and yes, it's expensive, but how much money do you spend on other things when you could save the money for this and invest in this monthly? We put money into things that we could be better invested in ourselves. And so the investment is worth it if you want healing of mind, body, and spirit. I heard once that psychedelics, depression brought them to psychedelics and they found God. That is very true. And I wanted to say about ketamine specifically that for me, this is not a quick fix. It is a long-term solution.
Thank you for sharing that incredibly insightful perspective. It's really nice to hear how much it has over your life. And I would love to open up this space, hear what it is like for you all. So if we have any questions. Yeah.
I'm curious. So with ketamine, I know that there are troches, there are sprays. Some practices use intramuscular, some use intravenous. What modalities do you choose to work with? And I assume with what the patient is presenting with play into what you recommend for them?
Okay, yes, absolutely. Since we're not in a clinic supervised by a medical director or nurse, our options are self-administrable modalities. So it would be a troche, which is that lower dose Well, it can be higher dose as well. There's depending on dosage, the lozenge, and then we can also do nasal spray. And nasal spray, we would recommend for the deeper, more psychedelic sessions because you can layer it. It takes like 3 minutes for it to build up. So it's probably not as dynamic as an intramuscular, but it's pretty dynamic. We haven't had any problems with that. And so it depends on the comfort level of the person too. But a lot of people with PTSD and treatment resistant depression do like the deeper sessions. Someone who's really just stuck on hypervigilance all the time, and maybe they're a senior citizen and they've never had psychedelic experiences, and that's really not their preference. We find that the lower dose troche will still give all the benefits that we're looking for without a psychedelic destabilizing experience. So yeah, kind of what the person's presenting with / what their lifestyle preferences are, and we make it work for them. Mm-hmm.
Yes.
While we talk about how it's off-label legal, right, for psychotherapy use, there can still be issues with our licensing boards and, of course, insurance. Could you guys talk about your experience with your own licensing board? Some licensing boards will say,
I can.
Even though it's off-label, we don't think we're not comfortable.
My licensing board does support me, so I'm excited to say that we have had a couple brush-ins, and I did have to demonstrate where I was training, why I'm doing it, who's my collaborating physician, but I was really proud of Missouri. They didn't have a whole lot of information, and they don't have a psychedelic medicine board, which they probably will have to soon, but they did back me up. And so we do know that they're allowing and they're really encouraging for progressive treatments. And so as long as we look, competent, which is very important, I think that we're backed up. Insurance hasn't hassled us yet, which I'm sure, they're going to catch on to wanting a little bit more funding for specialties. So far I've been covered by insurance and been covered by the State Board of Missouri. They're really supportive.
Any tips or strategies that were helpful to get them on board?
Just proving your competence. You need to show that you're a competent therapist and that you need to show credentials. Where did you get trained to do this is important. They want to see training.
Do you have any thoughts on the use of these modalities ultimately help to sort of, flatten the curve in terms of survival?
We haven't had any ALS clients. We have had chronic illnesses. We have seen a reduction in symptoms and a increase in hope and vitality. So I don't know, but I would say it's worth a shot. So I would say they would be very good candidates to try the program and see if in a month they're feeling more relaxed and more resilient. Resilience is the name of the game, I think. Do you guys have any additional things to say for that?
I have a question about whether your clients make the nasal spray that or in your session.
Mm-hmm. We have both options available. We're finding actually people are a lot more comfortable and receptive at home. And frankly, Missouri is a big state, so it's actually more practical for many people. It also brings the cost down to about half of the therapist's costs. So we're not seeing any problems with people doing it at home. But Chiwoo does have an office where he's doing it in Joplin in person, where they're more extended and more personal care while you're doing the program.
Anything to like that?
I did want to say, look, you might look at Matthew's presentation a little bit, I forget his last name, but he was sharing with me last night some interesting research on ALS. Just, he might have something to say. And just as going back to this other question, if you're a practitioner, I really do recommend that you check with your malpractice insurance and make sure that they cover psychedelic-assisted therapy if you're interested in doing that. Not all places will, and that's a nice safeguard.
Anything you'd like to add?
Well, I was going to mention a little bit about the changing the client's belief system and how that might affect their physical, just like Tamala was sharing. It changed everything. It's about, I tell sometimes client about, I use a lot of metaphors, imagery. So, I have them imagine that they're trapped on a very fast going machine, like 150 miles per hour, and you don't know when this is going to end. And now add the context, the grounding force. Oh, you're just on a roller coaster. That eases you. Now it's not so much disorienting to I'm open to this experience and see what I didn't see before, and also feel that in my body. So, for me, I've seen a lot of clients change the way they view life changes and their symptoms change. For me personally, I have, like you were mentioning about the inflammatory, I have psoriasis, so I've struggled with it and with steroid, but now after ketamine, my own experience, I haven't had it come back. So
Fantastic.
I do see a lot of good things from it.
And she wants to say something.
Yeah, and we are just about out of time.
Okay.
We do have one more really quick.
I wanted to make one comment. The
Yeah.
pain,
Go ahead.
I forgot to mention the pain. I've known nothing but pain for many years, and I have no pain today. I have to say that. To your question, I started seeing Amanda. Each client is individual in her program, and then I moved remote because I live an hour outside of Springfield.
And one more question.
I was just curious, so the ketamine kind of has like an opioid-like effect on the brain.
No.
You talk about it like it just settles you, especially for someone who's super hypervigilant. I was curious, what would you say to the patient that's fearful of it being really addictive? Like, you say you do the therapies daily, so do you feel the effects of it throughout the entire day, or? I'm just curious because
I guess it depends on what you call effects. I mean, does it calm I take time every morning and meditate and take my medicine and settle my entire body. That is my prep every day. And I do find that throughout the day, it stays with me. I don't lose that calm that I established in the morning. I am working on, I don't like being interrupted. And that's, I know, part of just my brain. Don't interrupt me. So I know I'm still working on that component, but it really does stay with you the whole day. And it's a weird feeling in the beginning because you're expecting it always to come back. That's what you know. It's going to pop back at some moment. It hasn't popped back yet.
The acute effects are 90 minutes, but she's saying the calm lasts all day.
Any final closing thoughts? No? Okay. Well, thank you all so much for being here.